Puerto Rico Medical Board Style Clinical Vignettes. Topic: Acute Pyelonephritis. Vignette 1. Classic Acute Pyelonephritis Presentation. A 26-year-old woman presents to the emergency department with fever, chills, flank pain, and dysuria for the past 2 days. On examination, she has a temperature of 38.9 degrees Celsius, 100 degrees Fahrenheit, costovertebral angle, CVA tenderness, and mild suprapubic tenderness. Urinalysis shows positive leukocyte esterase, nitrites, numerous WBCs, and white blood cell casts. What is the most likely diagnosis? A. Cystitis. B. Glomerulonephritis. C. Acute pyelonephritis. Correct answer C. Acute pyelonephritis. Explanation: the presence of systemic signs, fever, chills, CVA tenderness, and WBC casts confirms the diagnosis of upper urinary tract infection, i.e. pyelonephritis. Vignette 2. Pyelonephritis and pregnancy. A 32-year-old pregnant woman at 26 weeks gestation presents with fever, flank pain, nausea, and dysuria. Physical exam shows CVA tenderness, and UA shows bacteriuria and pyuria. Renal ultrasound shows no obstruction. Which of the following is the best initial treatment? A. Nitrofurantoin PO. B. Ciprofloxacin. C. IV ceftriaxone. D. Amoxicillin clavulanate P. Correct answer C. Ceftriaxone. Explanation: pregnant women with pyelonephritis require hospitalization and IV antibiotics due to the risk of preterm labor and sepsis. Ceftriaxone is safe and effective. Vignette 3. Pyelonephritis versus glomerulonephritis. A 45-year-old man presents with fever, flank pain, and hematuria. On exam, he is febrile and has CVA tenderness. Labs reveal elevated WBCs, urinalysis shows RBCs, WBCs, and WBC casts, but no red cell casts or proteinuria. Which of the following findings most distinguishes pyelonephritis from glomerulonephritis? A. Hematuria. B. WBC casts. C. CVA tenderness. D. Protein. Correct answer C. CVA tenderness. Explanation: CVA tenderness and systemic symptoms fever are hallmarks of pyelonephritis, while glomerulonephritis presents with red cell casts and significant proteinuria. Vignette 4. Pyelonephritis with complication. A 61-year-old diabetic woman is admitted for acute pyelonephritis. She has persistent fever after 4 days of IV antibiotics. Imaging shows air in the renal parenchyma. What is the most likely diagnosis? A. Renal abscess. B. Emphysematous pyelonephritis. C. Xanthogranulomatous pyelonephritis. D. Papillary necrosis. B. Emphysematous pyelonephritis. Explanation: diabetics are at risk for emphysematous pyelonephritis, a gas-producing infection of the renal parenchyma, often requiring surgical intervention. Vignette 5. Organism in recurrent pyelonephritis. A 35-year-old woman presents with her third episode of pyelonephritis this year. UA and cultures again show gram-negative rods. A renal US is negative for stones or obstruction. What is the most common causative organism? A. Klebsiella pneumoniae. B. Proteus mirabilis. C. Escherichia coli. D. Enterococcus faecalis. Correct answer C. Escherichia coli. Explanation: E. coli remains the most common uropathogen causing acute pyelonephritis, even in recurrent infections. Summary table: key points for acute pyelonephritis. Acute pyelonephritis, systemic symptoms, fever, chills, nausea, vomiting, local symptoms, flank pain, CVA tenderness, urinalysis. Findings: WBCs, WBC casts, positive nitrites, leukocyte esterase. Most common organism: E. coli uropathogenic strain. Risk factors: pregnancy, diabetes, urinary obstruction. Treatment: mild moderate, oral fluoroquinolones or TMP-SMX. Treatment: severe pregnant, IV ceftriaxone or other beta-lactam antibiotics. Let me know if you want